Hello, Senator Ted Alexander. My name is Tabitha Walker, and I'm a constituent of yours. I have been a nurse for over 8.5 years and have worked in numerous areas. I first started off as a CNA when I was 18 years old and have worked in the long-term care facility for over 5 years before becoming a nurse. I have worked at a rehab facility, a medical surgical floor, outpatient surgery, and I am now at Levine Cancer Institute. I would like to speak with you today about enforcing a policy of zero tolerance for abuse of employees, including seeking to increase penalties for physical assault on all registered nurses to promote a culture of workplace safety. This is also a platform on the North Carolina Nurses Association website. Daily, healthcare workers get assaulted by patients. These assaults can either be by getting hit, kicked, pushed, shoved, attacked, bit, or choked. Healthcare workers wake up each day to help save patients' lives, and they should not have to be worried about a patient trying to assault them. I personally have been a victim of these attacks, and it is a scary situation to partake in. At times, the patients may not understand what they are doing, especially if they are confused. But healthcare workers need to be reminded that they are a priority, especially at protecting their own lives. The bill H.R. 1309, which helps prevent workplace violence for healthcare and social service workers act, needs to get passed immediately. What if this was your loved one doing their daily job, helping someone, and they get assaulted or seriously injured or worse, could possibly die? How would you feel if this was your loved one and they got assaulted and they died and you never got to see them or tell them goodbye? According to the OSHA, many workplace violence goes unnoticed. OSHA stated that in 2010, the Bureau of Labor Statistics reported over 11,000 healthcare workers were assaulted, which had increased by 19%. By having these assaults in the healthcare facilities, healthcare workers feel unsafe, and oftentimes they feel as if they aren't heard, as if their voice doesn't matter. If we could pass the H.R. 1309 bill to help prevent assaults on healthcare workers, we would not have a shortage of healthcare staff, healthcare workers would feel safe at their jobs, and they would feel as if their job matters. We need to protect our people who protects other people's lives. These healthcare workers risk their lives daily to continuously make sure people are safe, and we need to make sure they are safe. How are healthcare workers supposed to protect others when they cannot get protection for themselves when they need it the most? I consistently urge you to please consider passing this bill. Please increase the penalties for people who physically assault nurses, because it'll continue to happen until something drastically gets changed, and there will continuously be a decreased number of nurses working. There will be an increase of people feeling unsafe at their jobs, and people's lives are still at stake. Please consider making this a bill. Please consider nurses and their safety. Thank you.